Hello, everyone. Welcome to Lab Basics. Let's start the ball rolling with the first topic, entry and exit points. Let's listen to Ma'am Needs You, certified acupuncturist of Silang. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. So, nasa lang basics pa rin tayo. Entry and exit points. Okay. The organ clock, the entry and exit points. Yeah. Energy in the superficial meridians flows along from the one meridian to the other, from the end of one meridian to the beginning of the next. Curiously, it does not allow flow out of the last point of the earlier meridian into the first point of the following one. Sometimes it exits before arriving at the last point and enters the next meridian, not at the first but at the later point. The reason for this is not known, but it is important to know these exit and entry points by number. Okay? So, question, why do we have to know them? Because, again, we look for different connections between the meridians and organs so that when we find an excess and deficiency, we can use the shortest route to balance this, okay? There are many instances where this will be useful. Imagine an obese patient who is also anxious, excitable, suffers from insomnia, and is susceptible to paroxysmal tachycardia. It is clear that her heart yin is deficient and that the heart yang can rise from time to time. Obesity is when the spleen stores excessive nutrients and needs to be sedated. It would be ideal if the excess spleen dampness would be sent to the deficient heart yin. Okay? This cannot be done in any other way except through the connection of exit and entry points of the organ clock. Sedate spleen 21, the exit point, and tonify heart 1, the entry point. Remember that forbidden point to needle yung heart 1. So however, we can compromise the point and give it not in the center of the axilla, but at the end of the anterior axilla fold. Okay? The compromised location of heart 1 is illustrated in this drawing. Okay, tingnan po ninyo. Next po, Doc. So, to send energy from the triple warmer to the gallbladder, from the small intestine to the urinary bladder, from liver to the lung, it is only possible through the exit and entry points. If this transfer is done between meridians of the same polarity, it would be very easy. If energy is transferred between meridians of the opposite polarity, it would have the same effect as the low connecting points where there would be a change in polarity. Okay? Yun lang po. Thank you very much,
Thank you
everyone.
very
I
much,
hope you
Ma'am
learn.
Needs.
Thank you po, Doc.
Up next is Color of the Face. Let's listen to Ma'am Teresita Sumile of Rizal. Good afternoon, Ma'am Teresita.
Good afternoon, Doc. Good afternoon, everyone. Now let's study the color of the face. All through the history taking, we have time to observe the patient. We can judge the facial color, the expressions, the appearance of the tongue, and any obvious deformities or tics and tremors. Let us start with the color of the face. So, pale color of the face signifies heart blood deficiency or liver blood deficiency. Bright pale signifies lung yang condition. Dull pale signifies lung yin condition. And pale yellow signifies spleen blood and Qi deficiency. Paleness shows lack of blood or anemia. Since heart nourishes and synthesizes blood, this would mean that the blood and function of the heart is deficient, and liver stores the blood. If there is less blood, it also means that there is less blood to be stored. So this is called liver blood deficiency. Lung diseases such as dermatitis and asthma tend to manifest as a white color on the face, even though the cheeks or the rush could still be red. A yang dominant state of lung produces a bright white color, whereas a yin dominant state tends to manifest a dull white color. Okay? A pale yellow color on the face and body is generally a sign of spleen nutritional deficiency and a consequent functional deficiency. This can be seen in patients suffering from anorexia, chronic pancreatitis, and juvenile diabetes. Now let's go to red color of the face. Red indicates heart yang excess or liver yang excess. If the color of the face, the cheeks only is red, it signifies yin deficiency with ascending heat in any organ. If only the neck is red, it signifies lung or heart yin deficiency. Okay? Now, red color suggests heat in the area. Red face or neck means heat in the upper warmer, where the heart and lung reside. It also shows there is enough blood to redden the whole face and neck. When the face and neck are pale with red areas, it could mean blood deficiency or yin deficiency with heat. The liver stores and releases blood. So if the liver yang is high, the face shows red color. If in this case, the eyes would be red as well. This indicates an ascending liver yang. Purple cyanosis shows heart blood stagnation. Purple lips and center of the tongue only indicates spleen blood stagnation. Purple color indicates that the blood is not circulating freely and is stagnating. Hence, the complexion is not pink or red, but bluish red. Okay? Next is yellow color of the face. Bright yellow indicates spleen yang excess, and pale yellow indicates spleen, blood, and Qi deficiency. Though yellow color appears often in hepatitis or liver yang excess, or liver yin deficient and hyperactive yang in chronic hepatitis, it is also possible in type 1 diabetes mellitus and in anorexia nervosa, which is spleen, blood, and functional deficiency in both cases, that the patient has a pale yellow or sallow complexion. Gray color or blue color anywhere on the face or tongue indicates a kidney deficiency of some type. One needs to look for symptoms of coldness and dryness in order to determine the nature of the deficiency. Okay? Thank you po.
Thank you very much, Ma'am Teresita, for the presentation. Next, we'll listen to needling techniques to be presented by Ma'am Mildred Digma, certified acupuncturist from Apayao. Good afternoon, Ma'am Mildred.
Good afternoon po sa lahat. Good afternoon po sa ating mga classmates at sa mga tagapakinig. Our topic is needling techniques number 12. Moving cup. So ayan po, tingnan natin yung drawing, paano minumove yung cup. So this is an excellent method of massage and can be performed with cups with rubbing squeezer. Rubber squeezer. The skin needs to be rubbed with oil. So, kailangan po natin lagyan muna ng oil bago tayo mag-rub para hindi masakit sa balat. Olive oil kung meron. Pero kung wala po, pwedeng vegetable oil. Pwede rin po sa atin dito sa Pinas, siyempre very good yung VCO, Virgin Coconut Oil. And St. John's Wort Oil. Sa ibang bansa po siguro ito natatagpuan na. Wala sa atin yan eh. It's very warming. Pero kung nag-online tayo, meron na tayo yan. And then the cup is fixed at the spot and fold along the skin downwards or outward several times until there is a red skin reaction. The direction in which the cup could be full is decided by where the fluid should be dispelled to. Yan. Kaya mahalaga po yung ilalagyan muna natin ng oil para kahit saan mo i-direct yung iyong cup, susunod po yun. Pag walang oil, masakit po yan. Mahapdi. Hindi mo pati may gagalaw. This is very effective in neck pain, where the neck and shoulders are somewhat swollen. So pwede po yan. So yung mga nag-stiff neck, very good po yan. Ang bilis niyang ma-manipulate po yung, yung tonify or yung nagdi-dispel ng energy. It can be used to treat cellulitis and carpal tunnel syndrome locally to move the stagnant dampness. It is also very good for chronic sinusitis. When the patient complains that there is much mucus and the head is feeling fuzzy, moving cup is then performed on the neck. Yan. Sa neck po ninyo, basta careful lang po, tingnan nyo, baka naman may mga, po, kung may sugat, bawal po, bawal tapat kasi mapdi pag dinaanan. Okay. So, yung bleeding cup, ito po yung wet cupping, So, bleeding is used to release. So, nagbi-bleed po tayo to release heat from the area or an organ. Kasi sa TCM po, yung heat, sumasama po yun, nandun yun sa blood. Kaya kung marami pong heat yung katawan, ang pinapalabas natin yung heat through blood. So, blood stagnation from an area. So, bloodletting may be done in quiet a few ways. So, cupping could be used as one of the methods. Yung pagpapalabas po ng dugo, pwede yung cupping, yun nga, medyo susugatan ng konti. So, isang technique para lumabas yung init sa katawan. One needs to have the forceps ready with the ball of cotton wool, already moist with some surgical spirit, a lighter and a large cup, having highlight the area to be bleed. Cleaned skin, napakahalaga po nun po muna ninyo, linisin nyo ng alcohol, yung inyong i-bleed, and make several punctures with lancet in the area. So then immediately light the fire and place the cup on the bleeding area. So yung kapas yung ginagamit natin, itatapat mo po dun sa cup, pero wag yung painitin po yung bibig ng cup kasi pag umiinit po yun, magkakaroon ng iitim po yun gilid, masakit, pwedeng masugat. So that a greater amount of bleeding occurs in the cup. The cup is left for 5 minutes. 5 minutes lang po, wag papasobrahan. And then remove and the skin cleaned. The punctured area does not need to be dressed. So hindi po nyo kailangan takpan yung na-punctured. Kaya alam po ninyong kasi maliit lang naman po yung inopen nyo dun eh. So bleeding cup is very efficient method to eliminate heat from an organ, whether in an acute or chronic state. Yan. So, yun po yung napakabisa na nagtatanggal ng mga heat sa katawan. Halimbawa po yun, di ba, yung malapit ma-stroke, yan, maganda rin po yan. Kaya lang syempre, careful tayo sa kailangan malinis po yung mga part. Okay po, thank you po.
Thank you very much, Ma'am Mildred. We now listen once again to Ma'am Teresita Sumile for the earth element. Good afternoon, Ma'am Teresita. Good afternoon ulit.
Good afternoon po ulit, Dr. Hector and classmates. Now let's study about diseases and symptoms of earth element. Conditions that have already been discussed with appropriate therapies are overeating, hypoglycemia, dry mouth, excessive salivation, yin and yang worry, OCD or obsessive compulsive disorder. Poor hunger indicates stomach yang and Qi deficiency or heart yang deficiency. So treat stomach with UB21, the Bakshu point, which tonifies the function. Stomach 36, the earth point or house element point, which tonifies yang. Then REN 12, the influential point of all young organs. Pericardium 6, area distal point of the upper abdomen, and then the patient should be advised to eat warm cooked food. And heart yang should be tonified on heart 3 and SI3. Poor appetite indicates stomach yin deficiency or heart yin deficiency. Points are REN 12, the move front point of the stomach, which tonifies yin. Spleen 3, the urge point or the house element point, which tonifies yin. Stomach 43, the wood point or the grandmother point, tonifies yin. And then colorful aromatic food to whet the appetite in small portions. Heart yin could be tonified in heart 8, the mother and son cycle. Acute gastritis indicates stomach yang excess. REN 12, this is the alarm point of stomach, but in some patients, point REN 14 is painful. So, if so, the pain point should be needled as well as REN 12, as it is also the influential point of the hollow organs. Pericardium 6, the area distal point of upper abdomen, symptomatic for nausea and vomiting. Stomach 34, sedation, the Shiklif point used in acute situations to disperse energy quickly. More local pain points along the REN meridian could be used if there is heartburn, do 20, and other tranquilizing points. Okay? Now, it would be better if the patient refrains from eating normally. Maybe small bites of toasted white bread can be consumed with dilute peppermint tea throughout the day. Patient can be treated again 1 to 2 times per day. Symptoms should be improved in 1 to 2 days. Food should be introduced gradually, starting with bland soups and avoiding greasy, highly flavored meals. Okay? Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now proceed to general principles and general principles of acupuncture treatment, part 2. Let's welcome our presenter, Ma'am Lynn Galarita. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. We're on the second part of the general principles of acupuncture treatment. Previously, we learned that there are 3 general principles, namely regulating yin and yang, strengthening the body resistance, and eliminating the pathogenic factors. And the third is distinguishing the primary from secondary. For today, we'll discuss more on strengthening body resistance and eliminating pathogenic factors. In the course of disease, there is struggle between pathogenic qi and pathogenic factors. Kumbaga, may giyera sa loob ng katawan natin sa pagitan ng ating mga sundalo na panlaban sa sakit at yung mga invaders. So, mobilizing anti-pathogenic qi to defeat pathogenic factors is the right way to cure disease. So, how should this be done? First, strengthen body resistance by reinforcing anti-pathogenic qi and building up health. This will include our nutrition, rest or enough sleep, enough fluid intake, and the right mindset. So if our body resistance against disease is strengthened, pathogenic factors can be easily eliminated. When pathogenic factors are removed, in turn, body resistance is reinforced. Thus, strengthening body resistance is beneficial to dispelling pathogenic factors and vice versa. Patients with weak body resistance but pathogenic factors not yet strong enough, we have to strengthen body resistance first. While in patients with excessive pathogenic factors but body resistance is not yet damaged, we'll have to eliminate the pathogenic factor first. In patients with weak body resistance plus excessive pathogenic factors, we'll have to employ both methods simultaneously. That is, strengthening body resistance and eliminating pathogenic factors. So we have to distinguish which is primary from secondary. In patients with weak body resistance, we have to prioritize building body resistance and do something to get rid of pathogenic factors and vice versa. Whereas in patients in critical condition, which means there is excessive pathogenic factors and the body resistance is too weak, we have to strengthen body resistance first, then remove pathogenic factors. In patients where there is very poor condition with excessive pathogenic factors and weak body resistance, we'll have to eliminate pathogenic factor first and then strengthen body resistance. This is all for now. Let's continue our discussion on this topic tomorrow. Thank you for your attention.
Thank you very much, Ma'am Lean. That was very helpful indeed. Let's now listen once again to Ma'am Needs You, certified acupuncturist of Silang, Cavite, for the topic on sedation using the mother-son cycle. Good afternoon ulit, Ma'am Needs.
Good afternoon ulit po, Doc Hector and everyone. Sedation on mother-son cycle. Okay. Clinical example, yung mother and son cycle. Yung patient is, we have a patient here, a female, 34 years old, okay? A highly qualified doctor had two major problems, insomnia and migraine headaches. Since her teenage days, she had suffered from insomnia following late nights and intensive periods of studying for school examinations. When the exams were over, she could not get back to her normal sleeping times. Initially, as the examinations were only once during each term, her insomnia became worse in this period. But when she entered medical college, she had to study much harder and later into the night, and her insomnia worsened and became a permanent problem. Now, she was a senior doctor with no more examinations to pass, but she still had a cyclical form of sleep problems, okay? Her sleep was generally superficial and disturbed, but it would gradually worsen into completely sleepless nights, walang tulog. At the worst of this time, she would get her migraine headache. The pain started at the point of gallbladder 14 on the right side, and within 30 minutes, it would spread to the whole head. Okay? She described it as a million needles pricking her all around. She became very restless and agitated with a headache, and no medication helped. The last helpful treatment had been her morphine injection, which would gradually ease the pain and she would fall into a deep sleep. Her sleep pattern, but only after 4 to 5 days, the whole cycle would be repeated again. Okay? So paulit-ulit na. When this patient pumunta dun sa author, she had been having migraines about twice a month, had given up her job, and was looking for a cure in Asia. So, tinreach siya noong author during her migraine headache and then realized that it was best to treat her during the interval period and not at the worst time. So, this patient's basic problem was insomnia. Years of less sleep and intensive mental work had used up her heart yin. This heart yin deficiency has resulted in a chronic yang dominant state that caused the insomnia and mental restlessness. So yung insomnia is naging worse, the heart yang rose. Okay? The excess heart yang blocked the liver and gallbladder energies from flowing through, nag-flow na. The result was a gallbladder yang excess headache following severe insomnia. So dito po yung tower diagram, yun nanggaling sa heart, naging chronic disturbed sleep, mas mataas yung yang sa yin. And then naging insomnia, naging worse, tumaas lalo yung yang, the deficient yung yin. And then yung heart and small intestine, mataas, sumobra yung yang, nag-deficient yung heart, okay, yung yin. Okay, ito po yung, ito yung drawing naman sa excess in yang. The excess in son organ causes excess in mother organ. So kapag po yung excess yung organ na sun, katulad dito sa diagram natin, sa graph na natin, drawing, ang sun ay wood, mother ng wood ay fire. So nag-excess siya, nagkaroon din ng excess yung mother organ na apektuhan po. Okay? So let's go to the treatment. So concentrate on treating insomnia, tranquilizing points such as DU20, gallbladder. Ito po yung governing vessel 20, PC6, extra points Anmian, UB62. Tingnan na lang po natin sa Google kung nasaan po yung points sa graph o sa natin sa map ng acupuncture point, but not heart 7 as it is also the sedation point of heart and we have a yin deficiency. Okay, point heart 5 or the low connecting point of the heart is the best point here as it tonifies the heart yin but also sedates heart yang, so it prevents heart yang rising. Okay, GB14 as local point where the headache begins, and GB20 as symptomatic point for headache. Okay, so they started the treatment after the end of the migraine when she was sleeping well. Treatment was given in the evening daily for a period of 5 to 6 days. Then they stopped for a few days and restarted when the sleep pattern became disturbed. After treating daily for 3 to 4 days, insomnia was again better. Then they had a break in the treatment and the next treatment and restarted when the sleep became disturbed again. And then they repeat several times over the next 2 months and thus broke the cyclical pattern of insomnia. She never got her migraine again. Gumaling na rin. In this way, they cured the migraine without actually treating the migraine. This shows that by treating the excess in the sun organ, we could prevent an excess state in the mother organ. Intindihin na lang po natin, okay? So, when an organ has a yin deficiency, its yang is not controlled well and has a tendency to rise easily. If we now tonify the yin of the heart or the liver using points heart 9 or liver 8, the yin of these organs will improve. Okay, explanation po. But the yang will also increase. It may be only a slight increase but enough to cause the yang excess symptom of worse insomnia or conjunctivitis as the case may be. Okay? In fact, this is why the mother points are called the best tonification points of an organ because they tonify both the yin and the yang aspects. Okay? When you wish to tonify the yin aspect only without the complication of yang rising, it may be better to use the house element point or the orary point or the point belonging to its own element. So sa cases sa taas, point heart 8 or liver 1, yun yung ginamit. The same applies to the sedation points on the mother-son cycle. Sedation of liver 2 is sedation of liver yin and yang. In fact, more sedation of yin than of the yang. When we use liver 2 for sedating the yang of the liver, we must remember that the liver yin will go down considerably and if we can afford this to happen. Okay? Yan lang po. Thank you for attention.
Maraming salamat po, Ma'am Neats. Talagang nakakatulong. So this is where we could see the difference between a good practitioner and from a mediocre one. Okay, so let's now go to the next topic. Let's listen once again to Ma'am Lynn Galarita for the meridian theory. She will continue the discussion of the pericardium channel of Hanjue Yin. Good afternoon ulit, Ma'am Lynn.
Good afternoon ulit. So let's continue with Hanjuian. We're on the part 2. On the physiological significance of the channel changes, the pericardium channel has no areas of unique significance for observation, and there are no special considerations for palpating the pulse along the pericardium channel. So let's explore palpating the channel, pressing the points, and feeling the body surface. Pain in the area between pericardium 7 and pericardium 6, often sharp and distended, may indicate heat from constraint in the upper burner and often corresponds to such symptoms as irritability, insomnia, and or headaches. There may also be graininess or parang sandy, mabobohangin, in this area where there are stomach problems, the yin wave vessel type problems with internal organ nourishment, as pericardium 6 is also the master point of the yin wave channel. Tenderness or pain around pericardium 5 often coincides with chest pain or distension around CV12 that can also lead to irritability or restlessness. This is considered to be stagnation of phlegm. In fact, many psychological conditions will coincide with palpable changes in this area, especially when the pressure of life are the cause. This point is often used in treatment. The area rarely has nodules, but instead may show tenderness or a change in the quality of the subcutaneous fascia that involves a sense of crunchiness. The area around and above pericardium 4 will be often tight or inflexible when there is blood stasis in the collateral vessels of the pericardium. This often involves problems with circulation of blood to the heart organ. In more severe cases, there may even be a deep hard nodule in the area. If there is only a general swelling and or thickening of the fascia, it is easier to treat. Deep, hard nodules indicate a more serious condition, which is often unresponsive to treatment with acupuncture and herbs. Pain or hard nodules around PC3 often indicates phlegm or blood stasis in the throat or mediastinum. This is often accompanied by chest discomfort. If the nodule is quite hard, this may indicate the presence of growth or other physical changes in the throat. So in summary, if there is tenderness in pericardium 5 area, there is joint stasis leading to irritability and restlessness. If there is pain, it's an indication that there is phlegm stasis, which could lead to psychological complaints. If hard nodules can be palpated in the pericardium 3, this would indicate phlegm or blood stasis in throat or mediastinum, chest, and also chest discomfort. If there is pain, there's Julian heat causing inflammation in the throat. Sharp pain in the pericardium 7 and pericardium 6 area indicates excess heat trapped in the upper burner or the heart and the lungs. Grainy sensation here would indicate yin wave vessel not nourishing organs, and we have stomach complaints. Tenderness in pericardium 4 would indicate Qi stasis affecting the chest. If there are hard nodules It could mean there are problems with circulation in the blood to the heart organ. If there is tightness or thickness, it could mean chronic Julian type emotional condition or more serious heart vasculature condition. That's all for today. Thank you for listening.
Thank you very much, Ma'am Lynn. That was very helpful. We now come to the last topic for today. We are still on chest painful obstruction syndrome with the patterns. Let's talk about Qi and Yin deficiency. There is a feeling of oppression and pain in the chest that comes and goes. Of course, there will be palpitations, breathlessness, tiredness, dislike to speak, pale complexion, dizziness, blurred vision. And all the symptoms are aggravated by overexertion. So when you look at the tongue, since there is Yin deficiency, there is no coating. The pulse is fine or weak. This is deficiency of Qi and Yin of heart, lungs, and spleen. Heart deficiency causes palpitations. Lung deficiency causes breathlessness and pale complexion. When Yin is deficient, blood vessels lack nourishment. Blood cannot circulate properly, and this causes feeling of oppression and pain in the chest. This comes and goes, much lighter than in excess patterns. Treatment principle: tonify Qi, nourish Yin, move blood, invigorate connecting channels. Points: lung 9, bladder 13, heart 5, bladder 15, Ren 17, pericardium 6, stomach 36, spleen 6, Ren 4, all reinforcing, except for Ren 17 and pericardium 6, which should be needled with even method. Lung 9, bladder 13, heart 5, and bladder 15 are the points that tonify the lungs and heart respectively. Ren 17 and pericardium 6 move the Qi and blood in the chest. Stomach 36, spleen 6, and Ren 4 tonify Qi and nourish Yin. Now let's talk about heart and kidney Yin deficiency. There is also feeling of oppression and pain in the chest, being Yin deficiency. There's palpitations, night sweating, insomnia, sore back and knees. So this is very kidneys, including tinnitus and dizziness, feeling of heat in the evening. So the tongue, no coating with a hard crack. If there is empty heat, tongue is red. Pulse, floating empty. As in all cases of deficiency, pain in the chest is less severe than in excess conditions. Besides the Yin deficiency, there is nearly always some phlegm too, which causes the feeling of oppression and pain in the chest. All other manifestations are typical of Yin deficiency. Treatment principle: nourish Yin, benefit the kidneys, nourish the heart, calm the mind, stop the pain. Points: blood, you have to reinforce, bladder 14, Ren 17, bladder 14, you have to do reinforcement on the points bladder 14, bladder 23, Ren 4, kidney 3, and heart 6, kidney 25. While even method is done on pericardium 6 and Ren 17. Bladder 14, pericardium 6, and Ren 17 will move the Qi in the chest and stop the pain. Bladder 23, Ren 4, kidney 3, familiar points, they tonify kidneys. Heart 6 nourishes heart Yin, calms the mind, stops night sweating, and relieves chest pain. And kidney 25 is a local point for chest pain associated with a kidney pattern. Thank you very much, everyone, for joining. We hope to see you in our next presentation. Good afternoon.